With the government backing the concept of electronic health records, and with technology being used in every walk of life, more and more hospitals are looking into implementing EHR systems. It has become obvious that the paper record system is incapable of supplying caregivers with all the patient information they need in a way they can utilize it. This problem, as well as concerns for better quality and reduced costs, is being realized more and more. Studies report that EHR systems could save billions of dollars. Some of the main benefits of EHR systems that have been identified include reducing medical errors, improving quality of care, conserving physician time, sharing patient information among healthcare practitioners, and workflow efficiency. Even though some financially sound hospitals and physician offices are leaping into adopting EHR systems, at the same time, some small hospitals and small physician offices are lagging in the use of EHR systems, creating a digital divide. Although EHRs have the potential to improve quality of care, reduce medical errors, lower administration costs, incorporating them into clinical practice will require large investments in technology in addition to changes in existing systems and processes. Previous research on risk of EHR systems identified privacy and security as major concerns. Other risks identified were financial risk, billing errors in software systems becoming obsolete, software vendors going out of business, computer crashes and data capture anomalies, programming errors, automated process issues, and populating invalid information in a decision support system module of EHR systems. Previous research conducted in the area of EHR systems determined the risks, the benefits, and barriers, as well as analyzed the relationship between the adoption of EHR systems and the size of the hospital or physician office utilized. EHR software is designed to save medical organizations time and effort in processing patient information. Cons of using an EHR include having to protect the data to avoid identity theft and fraud. Keeping your system protected from ransomware is part of the cost of working with computerized patient data. Pros of using an EHR include a decrease in data entry errors and the ability to use voice and speak recognition to enter information even faster. A major pro of using a certified EHR is staff can demonstrate meaningful use and gain the financial incentives offered to practitioners from Medicare and Medicaid. The major barriers to adoption of an EHR system, as identified by some studies, was misalignment of cost and benefits or financial reimbursement. Other barriers have been identified are technical issues, system interoperability, concerns about privacy and confidentiality, of course, lack of health information data standards, lack of a well-trained clinician informatics workforce to lead the process, the number of vendors in the marketplace, authorship risk, audit log risk, integrity risk, too much information risk, inappropriate content, contradiction, inaction, documentation dissociation risk, and the transience of vendors. Electronic health records serve a critical role in the delivery of safer care, allowing ready access to coordinated medical records, decision support, clinical alerts, and follow-up screening reminders, but is not without vulnerabilities. Medical malpractice data provides a unique lens into these vulnerabilities by identifying the contributing factors associated with these events. EHR events rarely stand alone and can cause extensive harm, but they are encountered across the continuum of healthcare settings and must be understood in the context of broader system and care failures. Next steps should include organization-wide responses that embrace the EHR as an integral part of risk and patient safety programs, along with a system-wide awareness education around the vulnerabilities in EHR use. There should be IT, vendor, and clinician collaboration to understand providers' needs to help resolve the system design and functions of EHR.